What we're seeing unfold in New South Wales, and in particular in the Western Division of New South Wales, would not be happening if Scott Morrison had done his job, getting vaccines out to those communities. There is no national plan, and Labor is saying we need an urgent national plan. Aboriginal communities right across this country are sitting ducks, and we're seeing that unfold in slow motion in the Western Division of New South Wales. An extra 29 cases today, bringing the case numbers to over 190. The Premier in New South Wales has announced an extension of the lockdown in Greater Sydney. We know all those stories. But my focus is making sure that Aboriginal communities in Western New South Wales and right across this country are protected. We're hearing stories that in large Aboriginal communities, people can't get a vaccination for at least 30 days because there are no vaccines available. The 4-point plan that I am advocating is very simple and very straightforward. First of all, get some coordination happening. Aboriginal people should be in charge. I was at Tharrawal Medical Service yesterday, and you see what happens when vaccination programs are Aboriginal-led. There is no hesitancy, and people are lining up to get their vaccines. The second point is get a national plan organised. There isn't one. There is not a national plan. We can't play whack-a-mole with this thing or sending in the army when there's an emergency. We have to get ahead of that emergency. People need to understand what the implications are of this virus. They need to understand and have it explained to them. And if it takes door to door, that's what it takes. What the implications are if this virus gets loose out in the community. The implications are absolutely dire, and people need to understand that. And finally, there has to be local data. You can't plan without local data, and that's what we are calling for. It happens in other countries, so why can't it happen in Australia? I've been asked to make comments on two other issues, and that is the gender pay gap, and that we have been calling for the Morrison Government to take action on what is a worsening gender pay gap in this country. The APS is a good place to start. And in relation to Afghanistan, Australian people want to see what is fair and what is right. The government has had fair warning about this prospect, and they have acted very, very late in the piece. Matt? No?
Any questions, guys?
Oh, hi Linda, it's Shani here from SBS.
Hi Shani, how are you?
Good, thanks, how are you?
I'm well.
I just have a quick question about sentiment of Sydney. What's the feeling like over there on the ground? Now, a curfew in place. How are people feeling?
Well, the announcements were only made a couple of hours ago. I've had several texts. Some people are furious. People in Sydney, I think this is our 7th or 8th week. It'll make it 10 or 11 weeks by the maybe end of lockdown. It's a long time for people to be locked down, to be homeschooling. And where I really feel for people are small businesses who are not going to be able to sustain such a lengthy lockdown. The numbers are going up every day in Sydney. The infections in the community are not changing very much. Marginal changes. People have to do the right thing. people have to stay at home, practice social distancing, as hard as it is. And there are people who are very angry at the divide taking place in Sydney. Yes. What I'm calling for is a plan for Aboriginal communities across Australia. We are seeing in the Western Division of New South Wales what happens when this Delta virus gets into those communities. I don't think we've seen the half of it yet in Western New South Wales. There are resources out there, there is capacity, and people are wanting to do the right thing. But there needs to be vaccine availability, and the government cannot use the 4-point plan when we know that Scott Morrison promised that Aboriginal people, all Aboriginal people, be vaccinated by the end of winter. We're seeing that that is simply not the case. From my observation, there was a great deal of lack of coordination out in that area. There are many primary health providers, including the Aboriginal Medical Services. They are willing, absolutely willing to do their part, but they have to have the vaccines available to do that. It looks like they're getting out there now, but it is like shutting the gate. The horses are already bolted. I'll say that again. It's like shutting the gate. The horse has bolted out there. And what this shows us is that there needs to be a national plan for Aboriginal communities across Australia.
And just in terms of the AUSMAT and the ADF involvement that's occurring now in central and central western New South Wales, obviously some of those communities that they're going to do have high indigenous populations. Do you know if those teams are being met with any suspicion or any concern by some of those indigenous populations? Are you hearing anything about that?
I was very heartened to see the head of the ADF contingent out there emphasising on television 2 nights ago the importance of respect, the importance of understanding the community. And what I have said and what the Labor Party has said is it has to be Aboriginal led. That is the answer in those communities.
That's all my questions.
Thank you all.